Hello and welcome today. My name's Nash. I am from the AAYT. I'm going to go through and explain who that is. I'm just giving a couple of seconds for you all to land. There's a few people still coming in, so I will wait for that to happen. Okay, so I just would like to pay respect. So we recognise and pay respect to the deep and continuous connection to country of Aboriginal and Torres Strait Islander people as the first peoples of these nations. We would like to respectfully acknowledge the traditional owners and custodians of the lands, winds and waters on which our service is delivered. In my locality, that's the Turrbal and the Jagera peoples of Brisbane, the Quandamooka people of the Redlands, the Yugambeh language peoples of the Gold Coast and Logan, and the Yagara people also of Logan. We would like to pay our respect to our elders past and present and emerging. We acknowledge all the traditional teachers and lineages of yoga and show deep gratitude and respect for these practices and teachings being passed down over the many years. With honour, we continue to offer the teachings to our clients with our best intentions, care, understanding, and respect to those who have taught them to us. So AAYT is the Australasian Association of Yoga Therapists. We're the only body dedicated to solely to yoga therapy and supporting yoga therapists and progressing the modality within the health industry. We have defined the code of practice, the ethics, the standards for training and operations as a yoga therapist. Thank you to all of our expert team who are volunteers and yoga therapists who work hard to make all of this happen. Thank you to AusActive who have been supporting us so well since the merge that occurred earlier this year. So on our panel, we have, I'm actually not sure if you will see these people, but we have Robin Henwood, we have Sarjit Tory, we have Patricia Wigley, Lisa Fabry, who you know from our recent webinar, and we have Tanaya TM. They will be available to answer some questions for you at the end of my introduction to what is yoga therapy. And if you have any questions, please pop them in the chat. So we'll be getting to questions right at the end. There's a fair bit to share with you today, and it is just an overview. It's there's very much that we, once we start to break it all down, there's very much that yoga therapists do. So we can give you an overview today, but you will have, I'm sure, some questions. So my name is Nash. I'm a senior yoga teacher and a yoga therapist, with my first yoga therapy training being in 2015. I've interned in a hospital in India for 6 months full-time in the neurology, neurosurgery and labour and postnatal wards. I now work with 2 other therapists with clients with chronic conditions and disabilities in Brisbane and the Gold Coast. And I have been a registered NDIS provider since 2017. So if we can just click over to the next slide. Thanks, Isabella. Thanks for helping us with that. You know, what is yoga therapy? Sometimes I wish people would ask the question more, actually, because I've actually felt in times that people think that I'm just, they go, oh, just a yoga teacher trying to get funky with their title. But no, it's yoga therapy is actually a coined modality, and it sits inside the whole modality of yoga. So it's not separate to, but it is a part of yoga. And Larry Payne, the PhD, he was the founding president of IAYT. Now, IAYT is the international body similar to AAYT, and they're based in the USA. just for yoga therapy. And he says that yoga therapy started about a century ago. So there's the basis for us here. If we can click over to the next slide, Isabella. So this is an overview of yoga therapy. We draw from the full range of principles and practices of yoga. We use techniques to utilize that we utilize in our workings with people, the asana or the postures, the pranayama, the breath and energy awareness and techniques, mudra, which are gestures, often with hands, but can be full body, visualizations, chanting, relaxation, meditation, dietary advice, lifestyle counseling, and self-development guidance. So it's fairly extensive. Yoga therapy empowers clients or students to manage their own health. So we use a language, which is an ancient language that most of our texts and philosophy is written in. And so therefore, some of the language we use in our practices will come from this. So svadhyaya, it means self-study. So we encourage people through self-study and our assisted teaching to empower them to manage their own health. It's a professional therapeutic relationship, which is guided by the yoga therapist, but it's very much about a two-way street. We don't, it's not an us and them thing. We try and get the trust and rapport, which is very important for the healing to occur through the process. Yoga therapists have an understanding of Western medical pathology and biomedical knowledge, and that's extremely important part of our job. We must have that understanding under our scope of practice to be able to work with certain conditions. We don't ride off gun-ho just working with anybody. We must have that knowledge before we do. We provide this in a clinical setting. It's a one-to-one intake. Okay, that always has to happen. And from that point, we can work in small groups or in individual sessions. It's a therapeutic program developed for the individual needs of the client. So that means that, for example, I work with several people with brain injuries or, for example, cerebral palsy. Each of those people have their own idiosyncrasies that I would program differently. Just because they have the same condition doesn't mean that their program looks the same. It's guided by the yoga therapist with ongoing review, progress, and assessment all the way through. And what does that come out at the other end? We're teaching them and guiding them with the tools that we know about and can share with them, the tools of yoga, how to learn about themselves and manage their own health. It's a holistic approach to well-being. It looks at the mental, the physical, and the emotional impacts of their condition. And there's a whole lot more that will come out as we go along the way. Ill health and chronic injury are often compounded by multiple factors. So there's often comorbidities. If someone comes with a condition, let's use cerebral palsy because I used it before, that isn't the only thing that I'll be working with. So there'll be physical presentations there, there'll be the emotional aspect of having that condition, and, lots of other energetic things that might be present as well. Bear with me. So if we can just move on to the next slide. We've got different models and approaches. In yoga, there's many, many lineages, and you would have heard, oh, this style of yoga, that style of yoga. It often comes from different lineages, but those styles might fit within a lineage, and there's many different teachers within those lineages, and so it can really appear different. If two yoga therapists work with the one client, they might work in a different way to reach the same goal. So the model that we work under is the Vyuha. Again, there's that Sanskrit language, the Vyuha model, which is the 4-step model of healing. The Hayam, which is the issues, the symptoms or the problems. the hetu, which is the causative factors, the causes of what's going on, the hanam, which are the goals or the focus. Now, it's important to note here that it's the client's goals as well as the therapist, and then we find mutual goals that we work towards. Upayam, the tools and the progression. So how are we going to get there? We can move to the next slide. Thanks, Isabella. Okay, so here we go with the Sanskrit again, and it gets a little tongue-tying at times, but the Dwadasha Roga Lashana Anakrama. So that means the yogic 12-point system of diagnosis and health evaluation. So this is under the Gitananda lineage. And Swami Gitananda he was a medical doctor, and he's identified these 12 things as being important to assess when we're working with people. This is what makes the whole individual. So and also this, in this language, you'll hear a lot of stuff in Indian language, which will talk about diagnosis. We don't diagnose in Australia, we assess, and we have clients rather than patients. So there's some crossovers where we work a little differently with our language. So the trigunas are the manifestation of the three basic qualities, the tridoshas, the manifestations of the three humours. I'm going to explain a few of these as we go along, but this is an overview showing you that it's just the whole person. The trivasanas, the psychological background, the prana, which is the manifestations of the prana vayus, abhyasa, the personal discipline, jivakrama, the lifestyle, chetana, the quality of thoughts, vacha, the quality of speech, ahara, diet and food habits, viparita buddhi, the presence of destructive or bad habits, the jiva vrittis, body rates of the individual, and the sankalpa, the ideals that the individual holds. We can move to the next one, Isabella. So in those 12 points, there's not really, I can't think of anything that we're not going to assess with a person. You know, it's pretty comprehensive. We move, these are other ways that we will look to work with people. So these are parts of our system, that parts of the yogic system that makes up how we can work with yoga chikitsa. Yoga chikitsa is yoga therapy. The koshas. So I think we've talked about these before in Lisa's presentation, but they're very important to us. So we know that a person is made up of the 5 sheaths or the 5 koshas, manamaya koshas. The Annamaya kosha, the physical body, the most gross level. This is what's presenting: the physical body, the DNA, the cells, tissues, nerves, organs, and body systems. Pranamaya kosha, the energetic level, their aura, biomagnetic field, the nadis, the chakras. Again, they're going to come in a couple of slides if you're not sure what's being mentioned here. Manomaya kosha, the daily mind, the emotions, the feelings, the likes, the dislikes, the fears, the phobias. Vijnanamaya kosha, the wisdom, the higher mind, inner conscious, inner voice, values, belief systems, the intellect. And Anandamaya kosha, that bliss level, that being with self, that the nature of the individual. So we also believe that if there's an imbalance in one of the koshas, it will affect all of the koshas. So yeah, it's important for us to work in one level, which we know will affect all of the levels. And that's usually, we start with what we see, the gross level often, if we can. Not always though, not always. Moving forward, Isabella. So I hope you can make this out. They're not great pictures, but they're the best I could find. There's 72,000 nadis in our body. Some say 74. I've heard other numbers, but there's a lot. They're channels of nerve energy. So if you see in the head, you know, all of these lines, all of these nadis leading back, and then in the whole body, and see outside the body, these nadis expand into the aura of the person as well, it is believed. And Swami Gitananda refers to them as channels of nerve energy that fit in with all of the 9 physical structure systems. There's 3 main nadis that run through the system, the Ida, Pingala, and the Sushumna. So they run through the spine, and you can see pointing to them up in these points. As I said, brief overview. There's so much we could say about these things. Can we have a look at the next slide, Isabella? The chakras, mentioned also before, etheric energy. So these are the 7 main spinning wheels or vortexes of energy. Different lineages believe that there are more chakras than 7. I've heard them mention 9, even 13. So that's what I'm saying about lineages. These are the main ones that everyone agrees on. And Swami Gitananda has related them all to the different parts of the body, the endocrine system and the nervous system. So it makes sense, right? Like our nervous system running through our body, coming back into these, our energy systems that we're talking about in yoga therapy. It aligns very closely. Moving on. Did we miss? Oh, no. I'm not sure if there was one before that. Isabella, was there? Or no? Okay, sorry. Thank you. So these are the butas, again, working with energy and the energetic points. So if you think of the nerve systems, the peripheral nerves running through the body and reaching out into the extremities, the beliefs of the energy meeting into, and other systems have this as well, I should just say, like the meridians, very similar to the nadis. All we have, and you'll find this in Indian work as well. There's crossover with language. So we have Tejas, fire, in the thumb. We also have Agni. So different lineages use different names. So I'm pointing that out here as well. But fire, air, space, earth, and water. And so when we make the mudras with the fingers, we're touching certain points together to achieve certain energetic movements within the body. Also, these relate back to the koshas. So you can start to see how this all fits together. So when with the earth in the thumb, Annamaya kosha, water in the little finger, Pranamaya kosha, and so on. Fire, Manamaya, Vijnanamaya in air, and Anandamaya in space, Akash, that large finger. Moving forward. So yeah, Swami Gitananda mentions the pranavayus. So pancha is 5, right? Pranavayus, not a great picture. It's the best I could find to try and demonstrate what this, it's a hard concept to get your head around. So Vyana moving around the whole body, Udana moving up, Apana moving down, Samana more at the navel center. And I feel like Apana that is right in that elimination phase, right in the bottom there. So just to know that the pranavayus, the life force or the prana, the energy, it divides itself into these 5 vayus, which are governing different functions and aspects of being, and they move in different ways in the body. Okay, so moving forward, again, we mentioned the trigunas before. So Rajas is the principle of activity and passion. Tamas, the principle of inertia and darkness. Sattva, the principle of luminosity and wisdom. So, yeah, so we've got activity, inactivity, and balance, really. And homeostasis is measured in sattva. Yeah, we're always looking to bring everything back to balance. Energy, systems in the body, homeostasis. That's what we're looking for good health. I'm going to get to Patanjali, one of our sages and great masters, who gave us the sutras in our philosophy that give us information that helps us to work in this way. But he has said the pancha kleshas, the 5 kleshas, they're the root of all suffering. So avidya, ignorance; asmita, ego, identification; raga, attachment and desire; dvesha, aversion; abhivanesha is fear. So, and this is really important when we're working with people with mental health conditions or psychosocial conditions. These elements definitely come into play, and finding balance in belief systems and sankalpas. We talked about sankalpa before, the ideals of the person. There's deep belief systems, and the kleshas will have an effect on that. So if we can move forward. Okay, so I said we're going to talk about the sutras. So the sutras of Patanjali, pre-Patanjali, are held to be one of the foundational texts of classical yoga philosophy. They give purpose behind the system, practices, and guide to a life in wellness and optimum. And that, I mean, here's just an example of one sutra that shows you how we fit this into what we do. So this is Yoga Sutra from chapter 2, 29. The limbs of the Eightfold Path are as follows: respect for others, yama; yourself, niyama; harmony with your body, asana; your energy, pranayama; your thoughts, dharana; your emotions, pratyahara; contemplation, dhyana; and ecstasy is the samadhi. Yeah. So, and that, we can relate this back into the koshas as well. All of these things fit inside different levels of our sheaths as well. We're all made up by this, and if we live by this, we can find that balance that we're seeking, which is what we're always trying to achieve. Thanks, Isabella. So then we also use modern day science. We mentioned in the beginning, you know, the medical knowledge, biomedical knowledge, and science. So just a few things that I could think of immediately that you might be able to relate to is the nervous system regulation, big one. It's where I often will start with people, because if you you have a condition, there's all that anxiety around having the condition and having either the change in the life or not being able to participate in your life the way that you want to. So nervous system regulation is paramount in everything that we do. So this is just a little diagram showing, you know, what happens, brain activity, all that sort of stuff, which I'm sure most of you know lots about. We work with pain. We work with neurology. I mean, amazing things happen when we're working with energy with neurological conditions, really amazing things. Mindfulness, it's, you know, the buzzword. Well, it was. I think new things are coming in, but, you know, we work with these things. They're similar things, and we have different names for them in yoga, but we work in those ways. If we click through again, Isabella, just showing simply pain. Okay, there's a pain and there's an event, and the message, we all know it goes back to the brain. The brain will either release endorphins to reduce the pain, or, you know, increase the pain if we need to not use that area of our body. And we work in ways that helps to release more of that, bring into the parasympathetic system, work with the pain rather than around it. So yeah, just an example of that. Next one. Okay, this is Kaya Kriya. So it's a technique, and I chose this one because it's a great picture, right? You can see how it's working. It's a 3-part relaxation technique in which the lower, the middle, and the upper regions of the body are relaxed in succession with movement and breath combinations. After the 3 parts are combined, and then we're moving the whole body in one time, It's I've seen it work amazingly well with neurological conditions, epilepsy being one. And hopefully this would show you how all of those things that we just went through come into play by just doing one of our yoga techniques. There's a whole lot of energy movement, or the nadis, the breath is working in that way. So this is how it, the rubber hits the road. This is how we start pulling it all together. Next one. Thanks, Isabella. Now, what's really important is the process, the therapeutic process. Initial intake, as I mentioned in the beginning, it's a one-to-one. It's done in a clinical setting. It's about assessment and programming, which must occur before we start to deliver any support. And it has to continue with regularity as we work with the client and move through to try and reach the goals. We review, and because I do a lot of NDIS work, I just pop that in there. We report, like as other allied health modalities report. I'm constantly writing reports about what I'm achieving, what the goals are, how I am going to achieve those goals, what we have achieved, what we haven't achieved. A really good example is medication. Medication gets reduced, or other services are not required after they've been working with me for a while. Can we click forward, Isabella? So I'm just going to quickly share my screen here and just show you, because this is a in-house system that I've created, but it just goes over a little bit about intake and what we take. It's a multifaceted, fully comprehensive intake, just like anyone else would do in the allied health field. I've created a client, Jane Doe, here. Just normal personal details, NDIS stuff, plan managers, all those sorts of things. When I work with them, I need consent. I need to do a proper check. There's a lot of things that I need to make sure I go through with Jane Doe before I start working with her. Other reports, maybe she's got some psych reports or physio reports that I can refer to. What props I'm going to need. NDIS reports, that's usually reports I write, and who requested the service, so that'll come in. We'll do client intake. So I get the client to tell me where in their, like they'll mark on here what's going on in their body. I always do that.
Sorry, Ellen, you're just not sharing your screen.
Oh, okay. Thank you for telling me. I'm going on here. Okay, hang on, Isabella, let me help. Share screen. Okay, that's going to do it. There we go. Now you can see it. I'll quickly.
Yeah.
So that was yeah, great. Thanks for telling me. Yeah, just an in-house system that I've been developing. Still a bit of a works in progress, but it does all of my my client management, as well as my invoicing, as well as my bookings. So that's what I wanted. I couldn't find another system out there, so I had to build one. Yeah, so these are just the things that I was talking through, the personal details, the forms, the intake, all that sort of stuff, into client intake. So the client will get an email from me with a link to fill this in. So I get them to mark on the body where they are wanting to tell me there's issues going on. I have really funny clients. Sometimes put a big cross on the head and say, it's all in here. Anyway, they make me laugh. Date of birth, that sort of stuff. Emergency. I work online with people, so sometimes I might need to, if I'm seeing something on the other end and we need to call someone, I need that information. Height and weight, obvious reasons. I don't always ask height and weight, particularly if I'm working with someone with an eating disorder. Some of these questions are not for everybody. Children, we want to know, have they have they birthed, also their responsibilities, that sort of thing, educational qualifications. What level am I going to be pitching my stuff at? Their occupation, and if it's changed in the last couple of years, any yoga experience. I'm going to talk about that a little bit later on. Their goals, why are they coming to us? What are their expectations? What do they want? What makes their symptoms better or worse? Their general health, extremely fit right down to very poor health. I find if I get their perspective on that, I know where I'm working from. You know, what do they think about where they're at? Appetite, digestive issues, energy levels. How do you wake? I had to put feeling in there, because how do you wake up in the morning? Someone said, "Oh, open my eyes." But how they feel. Whether sleep is a really big thing for me when I'm working with people. Do they get to sleep well? Do they stay asleep? Can they get back to sleep? The poo questions then, bowel movements. So I'm usually asking a lot about that, bladder function, blood pressure. I'm not trained to take blood pressure. I don't take it, but I do ask them about it, obviously. Menstruation. Then a whole lot of general questions about a lot of different kinds of ailments that they may or may not have experienced, and what their situation with it is. So often it'll be a no, no, no. If there's a yes, I want more information. It gives me a place to go. If they fill it out, I'm still going through this with them once we meet. Yeah, all kinds of things, hepatitis, pain in different areas, headaches, shoulders, all those, past significant injuries, anything else they want to tell me about. You know, if they've had gender reassignment, I've had put in there and stuff like that. So there's lots of different things that we could be working with. Surgeries, and then family history plays a big part in people's wellness, and any current treatments that they might be having. And I'm going to talk about adjuncting down the line, but that's important. But also it tells me what is their, how do they feel? What do they like to access in the community? What has been their diet? Now, if I ask people, how's your diet? They usually say, oh, yeah, it's pretty good or not too bad. And then, yeah, I need to say, well, what have you eaten in the last 24 hours to find out actually what they've eaten, which usually won't be exactly what they've eaten, but it'll be what they want to tell me. Do they get any discomfort after eating, and cravings, things that give us tools to, things to look at. What their exercise or background, you know, recreational activities are, how much do they move, all that sort of stuff. Really important. Medication and supplements, just as I was saying before, like we can have contraindications to some of the practices that we offer, and medications can be one of the things that can make people lightheaded or, you know, more sleepy or whatever, and numerous things. So it's really important, and it's important for us to know what those medications do. So we need to look into that before we work with people. That's what I was saying, their approach to health, so that I know any other matters to mention. Because I'm doing NDIS work, I have a service agreement and I have a waiver. Yeah. And then we come to the therapist notes. So this is what I'm filling in when I'm with people. And I'm looking at all the different parts of the body. So again, I've got some Sanskrit in there, the darshanam, which is observation. And I'm just noting any things that might need attention, or, you know, flat feet I might write, or, you know, right shoulder 20 degrees higher than, you know, all those sorts of things, two centimeters higher or whatever. And then it'll help me to look further as I go. Sparshanam, palpation. So we're looking at joints, muscles, temperature, swelling, any crinks and cracks that we're hearing through the joints, finish what I'm saying. And then any individual idiosyncrasies that they may have. Sit to stand, walk, observations, and then some notes that I make an overall picture of what's going on. And then I'm doing, my functional assessments. I don't do all of this with all people, with all conditions. Okay, so I might pick and choose, and some of it might happen along the course of our treatment plan. It might not happen in the one intake. It's an awful lot. Some people we do need, but not everybody. So active range of movement and passive range of movement, and all the way through different parts of the body. And then I come down to prashnam, which is, support system, who lives at home, obstacles to practice, levels of stress, super important, what makes it better or worse, daily life history, what time do they wake up, what are they doing when they wake up, what do they do in the morning, how's their afternoon look, what do they do before bed, pre-sleep, especially if there's sleep issues, yeah. How are the weekends? A lot of my clients have no social network, and so they have support workers that come to them during the week, but the weekends they're really isolated. And so if I know that, I can work maybe with some of their other team to because well-being requires that connection, So all these things matter to the 5 layers of that person. So smoking, drinking, and caffeinated drinks. We don't request anyone to stop anything with yoga therapy. We just, as they do the practice, things change. We all see it, but we need to know what's going on because of contraindication stuff. So pulse, I would like to learn more about pulse taking, but I don't take pulse, so it's not something I'm trained in, but I know some other yoga therapists are, and the pulse tells us an awful lot about what's going on with a person. They're those rhythms, the body rhythms that were in the 12 areas. Blood pressure again, and here we get to those 4 areas, like the Buha model. So the symptoms. So I've just quickly filled in some details here about maybe this is a post-stroke person that I'm working with, or person that's had a stroke previously. They have anxiety, sleep disturbance, falls. They have strength issues and neurological deficits. The causative factors, well, obviously the stroke. However, what's aggravating it is the stress, rushing to complete tasks, the negative thinking about their situation, poor sleep the night before the session, and not stopping when tired. This is a person I'm actually thinking of that I've worked with. Precipitating, these factors are an events or stresses that initiate or promote the onset of any illness, disease, accident. So the things that led to this happening, alleviating, quiet, rest, calm, good sleep, taking time to carry out movement. So that's going to be how I start my practice. So here's our goals and focus, the Hanam. And like these are so my primary focus might be to regulate the nervous system, look at this, the things that really aggravate people, I will tend to triage in this area. So when they're not getting enough sleep, it's affecting everything. When they're anxious, it's affecting everything. So let's start with what we can reduce a little bit, and we can slowly work through this system. So this is my primary area. Pain is a big thing for people. Neurological patterning, so I'll start doing some of that in some of the practices, like what I showed you with the Kaya Kriya. It's great for neurological patterning for some conditions. And obviously looking at balance and falls prevention, because that's going to risk further unwellness. We'll then get to things like strength building. That's not the initial thing for me to work with. It'll move further down. And long term, I want a balanced person. I'm working towards wellness. It's always wellness, but my long term might change along the way. The tools and progression. So I might start with some breath work, 3-part easy breath. Most of the time I have to start with that because people aren't aware that they're not breathing in a way that's beneficial to their well-being. So I will start with just teaching them to breathe 3-part easy breathing, then moving into full yogic breathing. And I'll give them some yoga snacks. Now, yoga snacks are things that I want them to do throughout the day and regularly to come back to, maybe checking in with their breath. It might be checking in with what their thought process are. So thoughts and breath awareness. We'll do some cross-lateral patterning and some eye work for their neurological stuff, some balance stuff, tree, fallen star, simple stuff, and we'll be using the wall when we start this off. And then gradually we'll always start with the easiest thing and move further along, because we do no harm, right? And then, resting, Shavasana and Nidra. And then to progress it, I'd go into full yogic breath, maybe Ujjayi, Samavriti, Nadi Shuddhi, and build in more philosophy and meditation practice, and balancing into Warrior 3 and more difficult balance postures using the wall. So we'd start to build this up, and then we'd start to move away from the wall with the more simple ones and gradually progress. Ahara, dietary guidance, 1 coffee per day, and not on an empty stomach. But again, we're not telling people to stop things. We're just suggesting that maybe we've got this particular person has stomach issues. So it might be just worth trying for a day and seeing how we go, seeing if that helps things. Recording all of our sessions. We keep details of everything we do with people because we might have to report on it. Yeah, so I will stop sharing now, because I just wanted to show you, that gives a really good overview of all the things that we do in relation to assessment. Isabella, can you pop the other screens up? We want to seek to ascertain the core issues that feed the presenting conditions, including the belief systems, the lifestyle, and other personal challenges that create highly individualized personal practices that work hand in hand with the student's goals. So core issues, causes are what we're trying to ascertain from all of that assessing. We can move forward. So our programming is what continues along the journey, and the 4 steps of progression in yoga therapy: resting and release to begin with, functional restoration, so functional movement, strength building, and then empowerment of the person. Yeah, that's how all of our program will work to treat the issues along the way. We can move forward. So who can we work with? Everyone. I know it sounds a bit conceited to say that we can actually work with everyone, but I haven't found anyone that I can't work with yet. There can be obviously personality things where, like people work better with some people than others, and that's fine. But I just haven't found a person that I haven't been able to bring some benefit to their situation, which is lovely. Yoga therapy aims to treat issues in the form of any injury or illness at the physical, physiological, and/or psychological levels, presenting at that moment in time. So what we see in front of us, not what was before or what we're expecting, right at that moment. The role of the therapist to support and instruct the client to employ the techniques at their level of knowledge, so they don't have to have done it before, their capacity, their well-being. It aims to meet the client where they're at, regardless of their age, their fitness, their state of health, their belief system, or prior yoga experience. It's suitable for all people. There's no prior knowledge necessary. We'll go forward because, just to say that, what we do doesn't look like a yoga class. If you've been to a yoga class before, and many of us teach yoga classes, so we are yoga teachers first before we become yoga therapists. It doesn't look like that. Can, but it doesn't most of the time. So adjuncting, it's extremely important because we want to bring the well-being to the client. That's what we're there for. Our job is to support that person back to balance and well-being. And it takes a village. We're not everything to all people. We all bring what we bring including their medical team and like down the bottom, our therapeutic teams that I've worked with, physios, their medical team, psychs, OTs, exercise physios, PTs, massage therapists, chiros, osteopaths, even art, music and dance therapists. We all bring what we bring to support the well-being with people. Funding, like under the NDIS, there's only so much funding for different modalities, and if a physio is working with someone on strength building, well, then I don't have to worry about that. I can work in other ways. And they seem to I have lots of them that work in with me. We share clients and we become their multidisciplinary team. The client feels well supported, and we're not in competition, or there's no striving for the business either way, because we all bring different things. And they have often said that it helps them with what they're trying to achieve with people. They notice the person's in a more balanced place, and so they gain more success. And also, helping them with different breath things while they're using their techniques has been helpful in the past. Because we work with such a broad range of different ailments, we can help, in numerous. I've worked in with psychs. One lady just couldn't see. She has severe and chronic depression, and she kept saying, "I'm not sure that. I don't know where this is going. Is this going well?" And we just couldn't. She was progressing well, and we could point out the things where she was progressing, but she wasn't really able to make that connection. And so I spoke with her psychologist, and she said, look, she loves paper tools. And we brought in this feeling circle, and how she was feeling before the sessions and how she was feeling after, and she had to fill it in on a paper tool. And then we showed her that, and that really made all the difference. She could see that she was progressing well. So little things like that are really worthwhile in that adjunction. And I always just reach out when I start working with someone if others are working with them as well. Yeah, we can move on. Thanks, Isabella. The structure of yoga therapy sessions, usually 60 to 90 minutes, sometimes even shorter if it's a young person. They don't have the attention span. When I'm doing intake, you've seen that intake, it's massive. So I sometimes have to break that up. And certainly, the functional stuff I will do over several times. But people could expect to have to attend more than one session over several months, because we need to reassess. We need to make sure that the techniques that we're offering are being done in the best possible way. Okay, we need to see them do it and know that they are being done correctly, that they're working in the direction of the goal. So are we on target? Is what we've chosen working towards achieving that goal? Does the practice progress with the client? Because they're going to move forward. And what I often say to people, because they'll go backwards as well and then forward, and sometimes a long way back if they have, just throw COVID into the mix for a person that's, already got a chronic condition, that's going to set them right back. So we will go right back. But then there's others that will just keep going ahead. And so we've got to make sure we're staying with them and that we're progressing out of the issue. And the issues can change along the way too. It's designed around the client, and the influence of that are their capacity to practice. So are they able to do this on their own? A lot of my clients are not able to do this on their own. And, are they unwell at that time and not able to practice? So you have to do the practices. It's not like popping a pill or, having an operation. It takes time. The practices are needed to be done. Exacerbating symptoms, like I said, we can have COVID or something coming in. There can be setbacks where there's an injury, maybe there's a fall or something. Support workers helping them is also necessary in some situations. And if they're a private client, maybe it's the financial factor. They can't afford to come each week. And also proximity. I've had that as an issue. I work online as well, but it's hard for people to get to sessions sometimes with their mobility and stuff like that, and their means of transport. We can move forward. And so what are our challenges as yoga therapists? The same thing that everyone says to me, all other allied health specialists, getting the client to do what you've asked them to do the practices. Yeah, that's always the biggest challenge. Attendance, if they're sick or stuff like that, keeping them on track and keeping them coming. Lifestyle issues can be sometimes more impacting than what the practices that are alleviating are. So, they could be, I don't know, just things can be difficult in there, chaotic and stuff like that. That's going to impact on their practices. Referrals, that's a challenge for us. Acceptance of the modality, knowledge of what the modality, it's a new and emerging field. So like chiros and psychs took 60 years to get ahead in their modality. So we're new. People have preconceived ideas about yoga because they've been to their local gym and they think that's what it's going to be like. Even in the NDIS, they say, "Oh, that's a physical thing." So, I'm crossing that bridge all the time, and getting that government and healthcare recognition. Yoga therapists also bring some challenges themselves, not having enough training, because it's an unregulated industry. We have people that are calling themselves yoga therapists that haven't actually done yoga therapy training. They're unregistered yoga therapists. So we're certified and registered in the AAYT, now Oz Active. And also their business operations. They might not know how to run a business. So that lets the team down, doing reports and stuff like that. So need training on those sorts of things. Next one, I think we're just about done. What's the difference between a yoga therapist and a yoga teacher, and a yoga therapy session versus a yoga class? Well, we're all yoga teachers as well as yoga therapists. Yoga therapy session looks very little like a yoga class, as I've said. We do assessment, reassessment, programming, addressing the specific needs of the individual for their condition. Therapist has to be a yoga teacher with experience before being submitted into yoga therapy training, which includes supervision, and it's undertaken over a minimum of 2 years. So some are 4 years, they're longer. A yoga teacher is trained in how to deliver and structure a class, presenting with some modification or leveling, which is, the basis of what we do, but then we're doing all of that assessment as well. And, there's a lot of yoga teachers that are senior yoga teachers and they do privates and those sorts of things. And there's nothing wrong with that, but that's a private yoga session. It's not a yoga therapy session. They're different things. But yoga teachers and yoga therapists both have the scope of practice to do no harm and work within our ethical boundaries. Yeah, I think that's it, Isabella. Or is that? Okay. So we're having another Sangha. So a Sangha is a Sanskrit word for a community meeting like this or webinar in the other world. And we'll be talking more about, there's a lot of stuff about ethics and scope of practice that we can add into that as well. And yes, I hope you, there's a whole lot more, but the time is gone. And we will answer your questions, hopefully. And I hope that gave you a broad overview of what we do and how we do it. Yes, just references. So hand over to you, Robin, if there's any questions that we can get through there in the last little bit of time.
Thank you. Wonderful, Ellen. That was really comprehensive. I think we haven't at this stage. We've only got a couple of comments in the chat. Let me see if I can say, yeah, no, I've got someone that says yoga therapy sounds complex, but with the general understanding I'm getting, I can already identify a couple of clients who might benefit. So that was one comment. And the other one was a comment to commitment. As you were speaking, someone said commitment to continuous improvement, but I don't have any other questions at this stage. But people could ask, because the next one is about how to become a yoga therapist. If they joined us for that, they could ask that or send them in and they could be sent on to be answered, I guess. Oh, here we are.
And also you can email AusActive, who we're part of AusActive, so they will pass those on to us and we will definitely get back to you. Just to say that next Sangha it's not a sales spam session. We're not trying to sign you up as yoga therapists. That's not what we're doing, but we want you to understand our modality so that we can adjunct with you and we can share some of our clients with you and we can work best for the best of the clients that we work with. So please do attend that. We will, answer all of those other questions then, but if you have any more, pop them in.
Yeah, there's none at the moment.
There is a question that's come through.
Oh, is there? Whereabouts?
Yes, positive impact. I can see. Do you have any good news stories? Yeah.
I have some great. Go.
There's endless good news stories. But if anyone else wants to flap their gums for a little while, I've got a million good news stories. That's why I do this. I love those good news. It's just makes my heart sing when I see people progressing the way they do.
And I think perhaps I'd like to add that Ellen works with some people that have got some very big problems, and I think there's a range of people that we work with. Like sometimes I only see a client once or twice. They're in what we say, we need chikitsa, we need the healing part of yoga to bring them back to wellness, and that may not take a lot of sessions if they're highly motivated to do their practice and they do it. And it can be something as simple as I'm seeing someone next week whose mother says her daughter's got a stoop and she's worried about her body developing properly, and that'll probably be 1 or 2 sessions. So it's not always that we have to have this continuous meeting with them if the goal is reached before that. I've got a question here. When would you require a medical clearance to start working with a client? What would make you require one? Ellen?
I can answer it, but does anyone else want to? I don't want to.
Patricia? Unmute yourself, Patricia.
I was just gesturing towards Ellen, saying, go ahead, Ellen. When would you?
So it's interesting. We did have a conversation about this before the Sangha, because I believe there's in AusActive, in the standards, there's rules about referrals and so on. However, we're trained extensively in assessment, as you would. That's what I was hoping to get across to you. It's a constant path of assessment and reassessment. So we would have the knowledge. I've got my fingers crossed, but I feel very confident that I have the knowledge to be able to decide for myself whether I have the capacity to work with someone. I work within my scope. All of us should be working within scope. And if it's outside my scope, I'm going to connect with the village of adjunctors that I'm working with to say, do you think that this is okay? And if they've got any doubts, I would refer back to whoever is the expert in that before I would go any further. Do no harm is our number one, ahimsa, do no harm. So we don't want to cause any problems.
Another question, how much does a typical session cost? Anyone want to answer that?
How long is your bit of string? Because I have seen people charging $250 for a private yoga session for 1 hour in Brisbane. That is overpriced, in my opinion. I do not charge that. In the NDIS, there are rules and regulations about pricing, and that I don't want to start talking NDIS because that's a works in progress, but people will assign charges that they feel comfortable with, but that's part of our training as well. You know, you can't, I don't know. You just have to feel okay with it yourself. And like, if I'm charging the same as the head psychologist, I don't, you know, it's just got to be relative.
Yeah, and fair. There's a question here from Isan. In regard to chronic anxiety, what would be the first thing your practice would advise they start working on in general?
Individual assessment.
You can't do it.
Can I just answer that one? I think we all know the answer here on the panel, but it is like the main principle in yoga and yoga therapy is to work with the breath. You know, so breath is central to yoga. Breath is central to life. Breath is central to yoga, and that's where we make the most changes. Like 80% of the effect of our practice comes from the working with the breath. Yes, so that is a figure that I have not just drawn out of the air. It was given to me when I was studying. Yeah. That is where we start. Start with the breath, because most people sorry, Robin, because a lot of us, including us as therapists, know that when you are anxious or disturbed in any way, your breath is affected straight away. So that's the first thing that we adjust. After our assessment, the breath is usually where we start. Yeah.
I'd actually, there was a student I had that I couldn't even work with the breath. I had to send her for a walk because it wasn't even able to come to that. But that's a long time ago. I might work with her differently now. Okay, hang on a minute.
I would second that, Robin, because sometimes the breath for very anxious people, they can't go there. So there's a lot of stuff that, but Patricia is right. It's a principle that we would start with.
And then we can work around that too, in that we
someone is asking, is there anyone in Perth, Western Australia, I could contact by phone? I know Tanaya.
I'm happy for anyone to contact me by phone. You can find me through my website. If you just shoot me a message, mindbodycollective.com.au, and we can connect, and I'm happy to answer any questions and also talk about the prerequisites required, even though we're going to be covering that in the next session. But if you have any questions in the meantime, happy to help.
All right, one more question here. I have a friend who has MS and his health has declined considerably. Is that possibly a condition yoga therapy could help with? Yes?
Totally.
Yeah,
totally.
Okay, lots of thank yous here. I can't see anything else.
Go back to Patricia, because she was just rounding off what she said, which was very good.
Thank you, Ellen. So it was just to comment on, if we can't work with somebody because their breath is really disturbed, we can then use sound, so that we with the sound, as we exhale, we're lengthening the exhale. So we might be just making simple sounds like ah, and as we do that, we are lengthening the breath, and it requires then a nice deep inhale, so that we can create quite a nice practice just by using very simple sounds. If people are open to it, even just singing or humming, we know has a wonderful calming effect on the body. So that's what I wanted to say.
And just to say, so I am in Brisbane and the Gold Coast. Lisa and Robin are in South Australia. Sarjit and Patricia are in Sydney, and Tanaya is in WA. So but we work for all yoga therapists, but if that helps you to contact someone closer than you.
So our details should all be on the AusActive website. So if you want to contact any of us, please do.
Someone
Sorry,
says
I've
awesome.
gone over.
Thank you,
Music.
everybody.